Hello and good day. All right, based on say popular request, today I'm going to be talking about the different types of discharge that women face and what the colors imply. So, firstly, let's start with the normal discharge. The number one discharge that women have often, and I'm going to tell you what it entails, is usually the one that is considered to be safe. Is usually white color or a little bit off color and non-smelly. So what is going on here is your womb, which is the uterus, has a way of taking off bacteria and some dead cells, you know, out of the womb, and that procedure alone helps you clean the womb and helps you clean the vaginal pathway. Typically that's what it is, and there is no smell. So if you're having a white color or off color, just a small amount of it discharge, it's not necessarily an infection. All right, so let's get to the yeast infection. There is the second discharge. Now this one will present to be like a normal discharge, but the difference is that it comes with a little bit of itchiness and swelling, and oftentimes you might have what we call painful sexual experience. So when you get intimate, you can feel some pains. So that is the difference from the yeast infection and the regular one. They both have the same color, but this yeast infection will now come with swellings of the vagina and also a little bit of itching, and it's totally treatable, possibly seen in every 1 out of 5 women. There are lots of factors to that, but we'll talk about it later. The third kind of discharge is the BV, bacterial vaginosis. So bacterial vaginosis, yes, it can be sexually transmitted. The color is yellow or gray and comes with a foul smell. So if you have a foul smell and the discharge is yellowish or grayish, just know that you have BV, bacterial vaginosis, and is typically treated with antibiotics. Oftentimes you can get it from your sexual partner, and not every time, oftentimes. Now, the very common sexually transmitted infection that come in form of discharge as well is the one we call the trichomoniasis. So trichomoniasis comes in a very weird color. You're going to be seeing maybe a greenish discharge or a grayish discharge. So know that that is a typical STI and can be treated with antibiotics. The last one, which you might know, in fact this one is very, very key, I guess you should listen to it, is gonorrhea and chlamydia infection. Very notorious sexually transmitted infection. Oftentimes some clinicians and community pharmacists might tell you that gonorrhea doesn't really show a symptom in women, but now I want you to know that if you have gonorrhea as a woman, you are going to be having this particular discharge and this symptom. So listen closely. So for gonorrhea and chlamydia, which is a typical sexually transmitted infection, you are most likely to be having a yellowish color or a grayish color of discharge coming out, and sometimes it also comes with if not treated, you can migrate to what we call pelvic inflammatory disease, where you start having pain beneath your abdomen. Now, not all pelvic inflammatory disease is as a result of gonorrhea, but if you're having a grayish, greenish color of discharge, please go and run a test. You can do a urine culture test, or you can do a high vaginal swab test, and that can guide you. So share this video, follow Med Fact Africa on all YouTube platforms, share it amongst every woman and every woman in your cycle to get them informed. Thank you.